Good morning, good afternoon, good evening, everyone. My name is Alex Mejia. I am a Division Director at UNITAR, the United Nations Agency for Training and Research, based here in Geneva, Switzerland. I welcome you all to this webinar to share practical experiences of how our nations in Asia Pacific have managed the COVID experience from several perspectives, and especially from the perspective of the network of training centers of UNITAR called CIFAL. CIFAL is an acronym that stands for International Centers for Authorities and Leaders. It's an acronym that was conceived initially in French, but this network that comprises 20 affiliated centers around the world has 4 centers in the Asia Pacific region, in China, in South Korea, in the Philippines, and in Australia. All the directors of those centers are joining us, or the representatives, and I want to begin by expressing the appreciation of UNITAR and the United Nations as a whole, if I may, for this effort to share experiences, to share the things that you cannot see on the news, the things that you cannot read on the internet. There is nothing like the experience of what we call a practitioner, a professional, an expert that actually is on the ground, seeing what's happening and reacting to that. That is why we are having this webinar series. We started with the, by the way, please mute your microphones, all of you, if I may request that. This is why we are having this webinar series, open to the public, always with utmost openness, inclusiveness, and as an invitation for anyone that would like to hear these things. We have begun in this webinar series with the first webinar that was entitled Practical Experiences for Ibero-America, Spain, and Latin America, where UNITAR has 6 training centers. And then we went last week, that was 2 weeks ago, last week, we went to the webinar on how the COVID has affected, thank you very much for putting the presentation, how the COVID has affected the higher education sector, the universities. And today we are having the 3rd webinar on how practical experiences from Asia Pacific can be shared on how we are being affected by this pandemic. With that, allow me to begin sharing a presentation. And again, my name is Alex Mejia. This is the first slide. In the world, there are 194 countries, 193 member states of the United Nations. The Vatican is not, but we do have a close relationship with them. In addition to these 193 member states, there are several other territories that are important because they have territorial integrity and they are accounted as an entity. So in total, we have 213 countries and territories infected by this crisis. And you see there as well some of the green circles, the red circles, of course, the number of infections that just surpassed 2 million, unfortunately. The green circles, the people that have recovered, and the white circles, the people that have died, unfortunately. Next slide, please. So here you have the numbers. And in the numbers, I wanted to call your attention to what has happened exactly within a month from the 15th of March till yesterday, midnight. We went from 169,000 people infected with the coronavirus to 2 million, in excess of 2 million. And unfortunately from 6,000 deaths to 128,000 deaths. You see in these small circles what happened with the United States, now leading in number of total confirmed cases, the case of Spain, and the case of Italy. And what is not highlighted, but should be important to mention, is also what happened with China that has slowed the growth in number of cases and is actually reopening normal activities in some of the hardest hit areas. Next slide, please. In showing you these numbers and now this curve for the whole month of March and for what is, or most of it, or what is already passed with April, you see how an exponential growth this has been. And that exponential growth, of course, is something that worries everyone because it has surpassed everything and anything that we could have conceived before. We knew that this was an unknown virus from a family of viruses well known, the coronavirus disease, that indeed was transmitted amongst humans and was rather aggressive, and we never expected to have this level of cumulative cases. To the right, you see the number of cases per day. As of 15 April yesterday, 71,500 cases were reported. And this has to do a lot with the testing, the number of tests that are administered to the people. But regardless of some countries doing proper testing, a high emphasis in asking the population to actually get tested to see if they have the virus or not, or countries that don't have the availability of those tests to perform, still the numbers are, as I say, exponential, and they continue to grow. We will talk about some countries coming to a plateau, but as a whole, as this planet of ours, the Earth, this virus continues to rage and break havoc. Next, please. In the next slide, you see this interesting title, the McKinsey Outlook. And I wanted to explain that our colleagues at the UNDP, the Agency for Development, the United Nations Development Program, and this very prestigious and global consultancy firm, McKinsey, which we highly respect, organized a webinar a few weeks back. And it was quite interesting that McKinsey gave their view on what would be the outlook on the global economy and two scenarios. We have adapted this a little with our own information, but if I may, you will see two possible future scenarios. There could be more, of course, but to simplify things, a short recovery that basically sees this pandemic growing in the Americas, Europe, and Africa until the middle of this second quarter, which is the middle of May. And another one, a prolonged recovery, something that will take longer, in which this virus does not decline with the change of seasons in the Northern Hemisphere, but continues creating a demand shock. So it affects the economy greatly until the second quarter of 2021. In that prolonged scenario, the health systems are overwhelmed in many countries, especially the poorest, with large-scale human and economic impact. Next, please. Here you see, before we get into the details of this outlook prepared by McKinsey and UNDP, and the credit should go to theirs, of course, to them. You see that this virus is quite unique. It has almost 2 times the reproduction rate of the flu, the normal flu. 17% of the cases as of recent, perhaps this number has actually increased during this week. 17% of the cases are severe, so they require oxygen and respirator. And those respirators, as you all know, just watching the news, are in high demand. And in some countries, there is a shortage. And then 5% of the cases are critical, regarding the ventilation, as I say, and not only oxygen, but also requiring an ICU, an intensive care unit. Normally, the respirators are already in an ICU. And this ICU is intensive in the use of technology, in the use of human resources, health professionals, and is indeed critical because the mortality presents there. You see to the right that approximately 4 or 5% of the people that actually get infected die, which is very sad. And these numbers, of course, are based on our colleagues at the World Health Organization. To compare that mortality rate between 4 and 5%, you have to remember that seasonal influenza, the flu, it's below 0.1%, not 1%, but 0.1. And to the right, I won't be explaining the whole graph, but if you can see that in a comparison between the coronavirus and other diseases, the COVID-19, which is the disease produced by the coronavirus, you will see that there's still being medium to low the case fatality as compared with another ones that perhaps you remember as the SARS, MERS, or the Ebola. To the left, to the vertical axis, you see that in reproductive numbers, it is also medium to medium low. So it's less than the chickenpox, but definitely not more, than the influenza, the Zika virus, and even Ebola. Next, please. In the next slide, you see these lines with the exponential growth in which the United States and Italy continue to grow very aggressively. Spain is somehow in the middle. China is very much in the plateau. However, we have some news that in the case of China, perhaps there could be a small resurgence of the virus. We will talk about it later on. These numbers go from the end of last year until the day before yesterday, April the 14th. Next. Here you see the first scenario in the next slide, that is the short recovery. Short recovery basically postulates that the virus continues to spread across the Americas, Europe, and Africa until the middle of this quarter, as I say, the mid of May, next month, when virus seasonality combined with a stronger public health that we have seen globally drives the case load down. And this is taken from the McKinsey Outlook report, which you can see is thanks to the generosity Global Commons, I think is on their website, mckinsey.com or so. So what McKinsey and UNDP did was to link this epidemiological scenario, the public health perspective, with the economic perspective, and this is what we are attempting to do here. In the epidemiological scenario, the US and European case count growth rises rapidly through mid-April, which is what we are seeing. The United States of America is really foreseeing cases surpassing 1 million people just in their country, and it's working hard to adapt the response in the health system, ICU units, respirators, and the like. Health professionals overwhelmed already. Test availability is enhanced in this scenario as it is happening, and the extent of cases is fully discovered by late April. Maybe this will take longer, but indeed, the number of tests have been enhanced globally. More aggressive shutdowns happen and social distancing reduces the spread. This aggressive shutdown is happening in very many places, except in Europe. In Europe, the lockdown continues, but we don't see more aggressive shutdowns anymore. Perhaps some countries considering to go back to normal, at least partially, as is the case of Spain since last Monday. In the fall 2020, we see a small resurgence of the virus in this scenario, although more countries have better public health preparedness. Then the Middle East, Southeast and South Asia and Africa experience worse effects due to the warm climates and young demographics. So this scenario that you're looking at, prepared by McKinsey, is basically saying that the seasonality, that the temperature change actually drive the rate of infection down. That has been contested, of course, because we have seen that in countries with warm climates, that the virus has still wreaked havoc, as I say. However, we do think that the lower rate of contagion in some of these countries that are more tropical and warm obeys a similar pattern to the one followed by other viruses. And finally, China and East Asian countries continue their current recovery and control the virus by late second quarter, which is June. Next, please. Here you see the economic impacts postulated by McKinsey. China and East Asian countries start recovery, but supply chains remain impaired in much of the second quarter, and consumer spending is subdued. In the US and Europe, large-scale quarantines, travel restrictions, and social distancing drop off in consumer spending in subsequent business investment decreases in 2020. There is, unfortunately, and we are already seeing that all over in very many countries, layoffs, so unemployment rates are higher, corporate bankruptcies, putting pressure on the banking and the financial system, monetary easing, which is basically injecting more currency, more money into the economy and strengthening the currency availability, but this has limited impact with already low rates and fiscal responses that have proven to be somehow insufficient or perhaps poorly timed. Then there is the dynamics for a recession are self-reinforcing because of all the things that we say. and extended GDP declines go through the third quarter, and the recovery begins only late in the year. In 2020, the global GDP growth falls sharply. You will see in one of the slides coming up that the IMF last Thursday forecasted that 3% global GDP will be lost this year. We will decrease by 3%. So these will drive possible recessions in the US and Europe, and definitely slower growth in China and other Asian countries. Next slide, please. Here you have a pictures that says it all from the point of view of the economy. This is a snapshot of how the equity markets by country have been performing since the year 2007 and until last month, the end of March. You see that deep down effect of the global recession of 2008, 2009. And to the right, you see the nomenclature assigned to each line and each color. You have the stock markets in India, the US, Brazil, Germany, China, Japan, the UK, France, and Russia. And of course, all of them, if not most of them, have been impacted. The equity markets definitely are down as fear of recessions drove investors to safe havens. Most exchanges lost around one third of their value. Next slide, please. So the next scenario is the prolonged recovery that we will get better only in 2021. We here are postulating, following McKinsey's step, that the virus spreads globally without a seasonal decline, creating a demand shock that lasts until the second quarter of 2021. That is mid of next year. Health systems are overwhelmed in many countries, especially the poorest, with large-scale human and economic impact. I won't read the epidemiological scenario, but basically you see that there could be a mutated virus resurgent in the fall of 2020. God willing, that will not happen, but we have to plan for the worst case scenario, this being one of them. So the restrictions on travel and quarantines across the world are tightened further because of this resurgence in an attempt to stem the tide, and definitely the recession kicks in. Next, please. In this scenario, you see the economic impact of a prolonged recovery that will take us to 2021, in which China and East Asia experienced double-dip slowdowns, the first one and the second one, as the economic recovery is derailed during this year and pushed into the first quarter of 2021, the start of the recovery. The US and Europe experienced demand-side reductions in consumer and business spending and deal receptions this year. Layoffs and bankruptcies in the most affected sectors rise sharply throughout this year, feeding into the self-reinforcing downward spiral. Financial system distress is significant, but a full-scale banking crisis is averted due to better capitalization of banks on new macroprudential supervision in place. This is important to mention because some analysts and media outlets have started talking of a weak financial system with easy contagion if the first institution goes down and belly up, but that is not necessarily the case. We monitor the economy. I do that particularly in the Latin American region and in the US. I'm from Latin America and somehow in Europe. And if we learn something from the crisis, the previous global recession from 2008, 2009 was exactly that. It's not perfect, but we have strengthened the measures to prevent that the financial system.
웹에서 들어가셨던 건가요?
Excuse me, someone needs to mute because we are listening to you. If you can mute them, Sebastian, that would be good. But I was saying, perhaps the global financial system wouldn't be as rapidly affected. The International Monetary Fund, the World Bank, the regional banks, the Asian Development Bank in this case, are very much monitoring fiscal policy, monetary policy, and also supporting developing countries financially so their financial systems continue to operate normally. But the global economy impact still is severe, with significant GDP contraction in most major economies in 2020 and a slow-moving recovery beginning only in the second quarter of 2021. Next slide, please. Here you see the numbers. You have this map of the world with the potential economic cost The negative economic contraction through GDP loss reduced output and productivity, of course, across all regions of the world in millions of US dollars. You see East Asia with 115 billion loss in a scenario which is not the worst by any means. Then China and Hong Kong with 111 billion, then Australia with 22 billion, and so on and so forth. Next slide, please. This is the chief economist of the International Monetary Fund, Ms. Jita Gopinath, who said that the Great Lockdown will result in the worst recession since the Great Depression. This is not may result, this will result, according to the forecast of what is happening as of now and what will continue to happen in the next couple of months. And here the debate, and this is something that we will debate also here in this webinar, but here the assumption and the debate that they have been having with the governments around the world, the IMF, according to what public information says, is that, of course, no matter how much the pressure to open the economy is, because that is what we are debating now, right? That we went from a global health, public health crisis to a global social crisis to a global macroeconomic crisis. And that succession of impacts, because of course there is all this high correlation amongst all these realms, that impact, no matter how big the demand to open the economies, as we see that the US is trying to do, the US administration, also the Spanish administration and so on, the IMF predicts by the end of the year, we will decrease 3%. And to compare that with the global financial crisis of 2008 and 9, the whole planet decreased only not 1%, but 0.1%. Next slide, please. And to finish this, the IMF says the coronavirus recession will be worse because even if with the assumption of the pandemic fades in the second half of 2020, so this is an ideal scenario. It's a short impact and a fast recovery. And the policy actions are taken around the world and that are effective in preventing widespread bankruptcies, job losses, and system-wide financial stress, still we will have this recession, but in 2021 we will recover. And that's a good news to approximately 5.8%. That will be the cumulative output that you will see. This is only a partial recovery from the pre-crisis projections. The cumulative output loss over 2020 and 2021 will be around $9 trillion with a T. Next, please. Now, we are learning as we speak, and we have learned several public policies. We focus on, from the point of view of the United Nations, of course, our Secretary General leading the charge on the health, public health sector, the WHO, very much active and so on. We see the need for interagency coordination at the national level and also harmonization at the regional and global level, because it must become a priority. The design of public policies to address major global challenges require greater attention to both developed and developing countries. So far, our attention has been on the Northern Hemisphere. It is turning to the Southern Hemisphere and developing nations as a whole, the global South, I would say. Now, more than ever, the objective established in the Agenda 2030 for Sustainable Development that the UN proposed in consultation with member states in September 2015 remains the basis and the reason for all public policy. It should be guiding all the decision making happening now, because it would be a pity that all the advances that we had in the last 5 years or so, since the end of 2015, will be lost. That this global drive to reduce poverty and inequalities and to protect the environment and the like are lost because of the pandemic. It would be a pity indeed, and public policy should take into account that whatever happens should protect the most vulnerable. Next one, please. Here you see that in some of the economic measures to maintain resilience, we have, of course, consider the need to secure, at least this is United Nations, of course, our Secretary General, as I say, to secure at least 2.5 trillion to address economic recession that COVID is causing. The states must conceptualize public policies that guarantee access to public services while facing the crisis, especially for the poor, and then to address their needs in the subsequent economic scenario. Some countries have already established mechanisms for injecting flows into the real economy through emergency bonds and loans, while others have developed public policies dispensing aggressive subsidies and payment of public services or rents. But we do know that these measures are not possible to maintain in the longer run. Every country national budget is under strain, dedicated resources as it should be to focus on the fight of the pandemic proper, on the health, public health realm, but then also in trying to sustain the economy when several countries almost came to a complete halt. Businesses are closed, production is low, and demand is almost non-existent with the exception of the basic necessities to eat or to perhaps have medical goods. The world will face a similar post-war second World War scenario, the experts believe, and placing funds in the global economy will be necessary not only to rescue companies and stabilize supply chains, but also to reduce inequalities and guarantee public services. The cancellation of sovereign debts of developed countries and increased international financial cooperation will be indispensable, and the United Nations is calling for that. And last but not least, let me go to social measures, and then I will wrap up with what is the next normal. In social measures, you will see that the establishment of new public-private partnerships to provide social services to even the most excluded populations will be a turning point in the post-COVID world. And here we are basically, among other things, proposing in every region that the private sector actually, we are in the next slide. Whoever is moving the slides, please pay attention. We are in the next slide, which is social measures. We are postulating that the public sector has a greater role in the fight against the pandemic, and especially in the recovery. And that will be something that has already started and that we would like to see soon. After that, let me tell you that shaping the next normal, perhaps we can see, next slide, shaping the next normal, 4 dimensions in Asia perhaps could be used to define the next step forwards. We will debate here, and I won't read these slides, the future of work and consumption, rethinking social contracts in order to sustain consumer and business confidence, because the collaboration, the synergy, the symbiosis between the public and private sectors, it's very high. And we almost take responsibility to support employment efforts, the employer and the employee as a whole. Next, and to conclude, the other 2 dimensions are mobilizing resources at speed and scale. If you measure the set of public policy that several countries have taken, some of them are very slow, no criticism intended, no names mentioned, but basically having the view that this is a problem of developed nations or of the global north, and not necessarily a problem of Latin America or of Sub-Saharan Africa or parts of Asia Pacific. That is not the case, and we see more and more countries finally scaling up and imposing prevention measures to prevent the harsher scenario, which is the more aggressive expansion in number of contagious persons, of people that has already acquired the coronavirus. And finally, the last dimension perhaps to analyze is to go from globalization to regionalization, because it is evident that global supply chains need to be restructured, especially in Asia, where a growing middle class creates its own demand for production. And in addition, various companies perhaps may accelerate the supply chain transition. In China, we are seeing some of that to other parts of Asia. Regional collaboration in Asia is already underway in responses to the spread of the coronavirus, as economies are sharing best practice and protocols. This is something that the United Nations very much admire and commend, and we hope that the rest of the world will learn from the Asia Pacific region. There is a proven track record for Asian countries in past crisis situations that give us hope and confidence. And with that, dear participants and colleague speakers, let me conclude. My time is over, and we should now go to the next speaker. Before I do that, I would like to also mention that this presentation is, of course, just the views from UNITAR, and of course, based on sources from WHO, from McKinsey and Company and UNDP, and so on and so forth, but we take full responsibility for them. And all of this is based on several assumptions that you all know. With that, let me now invite the first speaker to take the floor to tell us briefly the views from the Republic of Korea, and then also to introduce another speaker from the same country. Ambassador Kyung Hong Sul, who's the director of the United Nations Training Center, CIFAL Jeju, and also a United Nations Senior Fellow and a very prestigious senior career diplomat for the South African, for the South Korean government. Yes, thank you very much. For the South Korean government until recently. Is also part of the team at UNITAR, and we appreciate that Ambassador Sul will be with us, giving us the views from South Korea. Ambassador, the floor is yours.
Thank you, Alex. Before start, let me welcome actually Professor Yu. Professor Yu will make a presentation on the economic impact of coronavirus infection on Korea. And this is particularly honor for me to invite him to this webinar. With this, my presentation, I will try to be brief, but probably it will take about 5 to 6 minutes. And immediately after that, I'm sure that the Professor Yu will make a very succinct briefing about the issue. So with that, let me start with the overview on the coronavirus infection in Korea. The first confirmed case was reported on January 20th. The patient was a Chinese tourist from Wuhan in China. Since then, barely 90 days have passed, but over 10,600 cases have been confirmed as coronavirus infection in Korea. Among them, as of today, 229 people died of virus infection. If you look at the first slide, the perpendicular line shows the cumulative number of infection cases. Horizontal line shows the time series, dates in February, March, and so on. As you can see in the red circle in the chart, there was a steep upsurge of the infection cases in late February and early March, bringing up the number of infections from a few hundred to almost 8,000 in just about 10 days period. This rapid increase was mainly caused by cluster infections or group infections. In particular, it is suspected that one religious group may have played the role of super spreader in transmitting the virus. This particular religious group accounted for almost half of the total infections, like more than 5,000 people got infected from this group, which is quite shocking and alarming if you think about the effectiveness of the virus spread. Next slide, please. Can you move to the next? Yes. The recent statistics show a decreasing number of new infections. For the last few days, daily increase has stalled around 20 to 30. The pattern of infection has also changed. Now about half of the new infections come from abroad. It is not clear yet, but if this decreasing trend continues, we may be entering into a stabilized phase of the virus infection. But uncertainty still lingers. According to some reports, the COVID-19 virus is already in the process of mutation, which will make it more difficult for us to respond to this pandemic. Some of the cured patients are already, some of the cured patients are being tested positive again. This is another serious concern. Now, let me briefly talk about the Korean government's effort to fight back this pandemic. Can you move to the next slide, please? First, throughout the period, Disease Control Center, CDC, has played a very important role in managing the situation as the control tower. It has issued coherent and comprehensive measures, coordinating various activities among different levels of actors. CDC has provided daily briefings, updating the situation to the public. This was very helpful in attenuating the public's fear on the pandemic. While big decisions were made by the central government, it was this professional entity which has led the frontline battle. Secondly, one of the major issues that we had confronted in mid-February was on the issue of border control, whether we need to close the border or keep it open in the face of infectious disease. As I mentioned, in Korea, coronavirus infection started with a Chinese tourist from Wuhan, China. Therefore, there was a high demand to close the border with China. Medical experts particularly raised a concern over the incoming entrance of Chinese students in March, because in Korea, the school year starts on March the 2nd. The total number of Chinese students registered with universities in Korea was about 70,000. Therefore, it was feared that once these students enter the country, it would be virtually impossible to control the spread of the virus. So medical communities strongly appeal the closure of the border, at least temporarily for some time in March. The political leadership, however, has decided not to close the border. There could be some controversial discussions on the rationality of this decision, but up until now, we are maintaining the open door policy towards most of the countries. Instead, as an effort to reduce the imported infection, we have strengthened the entry procedures for incoming travelers, requiring the observance of self-isolation for 14 days and imposing mandatory testing in case they show COVID symptoms. Recently, all entering passengers have been required to get a visa, even if they had visa-free status before. Can you move to the next slide, please? Now, let me quickly cover the following 2 points on the early detection and isolation efforts. Like any cases involving infectious diseases, early detection is a key to prevent virus from spreading. In other words, the basic approach in this case should be, first of all, to identify infection cases as early as possible, and then we isolate those infected in quarantine facilities to contain further infection, and at the same time, provide them with intensive medical care. In order to initiate this whole process, it is clear that we need a very effective test kit for virus infections. In this respect, I think that Korea has been rather successful. Because of the previous experiences from SARS and MERS, a fast-track approval system has been introduced to facilitate the early production of medical appliances, test kits, or vaccines in emergency situations. Thanks to this system, several manufacturers could start producing test kits even at the early stage of infections, like in mid-February. Accordingly, our daily testing capacity has greatly increased from 3,000 in February to 15,000 in March, and now over 20,000 a day. In addition, test kits are capable of producing results only in 6 hours. Before it was 15 days, but now it has reduced to 6 hours, which is quite efficient test kits. With this, the government could provide extensive testing services to the public. Throughout the country, 635 clinics and medical centers have been designated as testing and diagnosis facilities. As a result, more than 500,000 cases have been tested so far. From those, about 2% turned out virus positive or virus infected. Another important measure taken by the national authorities will be thorough epidemiological investigations and imposition of quarantine and self-isolation. Once infection patients were identified, authorities conducted vigorous and thorough investigations to track potential infection routes. Detailed information on the whereabouts and possible contacted person with the confirmed patients were transparently shared with the public. Some concerns were voiced, of course, for the protection of individuals' privacy, but general sentiment seems more inclined toward public safety and health than the privacy right. In some cases, where the patients are not cooperative, authorities even used credit card use history, CCTV, and mobile phone location information to track down on such information. All close contacted persons identified through these investigations will be placed under self-isolation, which will be closely monitored by the government agencies. I will stop here for time's sake, and certainly I'll be very much interested in listening to the Professor Yu's presentation on the economic impact as well. Thank you, Alex.
Thank you, Ambassador, very much on point. And now it also gives me great pleasure. I join you in welcoming Professor Young-Il Yu, the Dean of the KDI School of Public Policy and Management. It's an honor to have you, Professor, with us. The floor is yours.
Thank you. It's a pleasure to be taking part in this. I'm actually in another meeting, and I just I'm taking a break from that meeting to join this. So I don't have a lot of time actually, and I was having some technical difficulty, but thank God. I think you can hear me, right? Can I share my slides?
Yes, go ahead. And thank you for making the effort, yes.
Yeah, but I get the message that when some other participant is using this slide share, I cannot use this function. So is someone else's?
We are all looking at your presentation, and you just need to change.
Oh, I see. You already have the file. Oh, I didn't know.
Yes. Go ahead.
Okay. Yeah. Great. The trouble is I don't have I don't see my file, but anyway, I'll just my presentation is really because I was told that I have 5 minutes, so I was just planning to go over really the very basics. So starting with the channels of economic impact from the pandemic. First of all, as we all know, we are restricting movement, social distance, and that creates, because people can't go to work, there is a supply side shock, production is declining, and then because they cannot go to stores, there's a demand shock, and as a result, there is this steep decline in a lot of places, depending on the strength of social distancing. Next, there is this financial problem, the feedback loop between the real economic decline and the financial deterioration is a great concern. And there are already signs of financial crisis. As we all know, after the global financial crisis, there has been all this quantitative easing and low interest rate and so on. And that led to ballooning of corporate debt in a lot of countries and over the whole world. This is a big concern. And then, as you all know, there's a huge outflow of capital. And now I am told that over half of the members of the IMF are already asking for rescue financing. So the financial crisis is unfolding. And there are, again, other complicating factors. There are this feedback loop between infections and inequality. Globally, inequality has increased a lot, and that exacerbates the infection problems, and infections also exacerbate inequalities. And what else? Oil price declines. And the biggest concern of all is actually the lack of disappearance of international leadership and international cooperation. So that is why the overall economic impact is so great. So the global economic outlook the first thing I want to mention is that although some countries, including Korea, actually I participated in a government meeting this morning here in Seoul, trying to devise an exit strategy from the strong social distancing measures. And a lot of countries are contemplating that, but it's a very difficult process because we all know that there is a risk of a second wave. And the case of China and Singapore that seem to have flattened the curve. After easing, they were having problems. And so while South Korea seems to have flattened the curve, we're very cautious about reopening the economy. And there is a study in the US during the Spanish flu, cities that have eased the suppression measures earlier actually suffered worse economic outcomes later. So there is a strong need for a cautious approach. And there are reasons, in my view, that a V-shaped sharp recovery is difficult to come by, and for a lot of reasons. And one important reason is the amount of uncertainty. And I'm citing, I'm showing a graph from a recent study that was just published in NBL working paper series, and that shows that the uncertainty is so huge that its impact is actually even bigger than the original shock, and that uncertainty is not going to go away easily. And if you look at the graph, I'm showing the graph from Chinese activity level that really tracks daily data. And after they effectively suppressed the infections, we don't see, usually after a supply shock, there is a V-shaped recovery, but it's not showing that. It's very, very gradual recovery of production and consumption. So as you all know, the IMF just the other day announced its latest forecast, and it is expecting the deepest global recession since the Great Depression, certainly a lot more serious than the Great Recession following the global financial crisis. I'm trying to remember what I put in my presentation because I cannot see it. Anyway, so very steep economic declines are expected. And finally, I want to say just a few words about the recent economic trends in Korea. I think my first slide there is the successful flattening of the curve in Korea. And as a result, we are able to reduce our movement of people, not relatively mildly. I think it's a lot of Korean people, consider it very seriously, and we are feeling the pain of this prolonged social distancing. Nonetheless, compared to other countries, our measures are relatively mild, and that, of course, owes a lot to the tracing, testing, and treating, is that it? The 3T strategies, and particularly the early action allowed us to take relatively mild measures. As a result, the macroeconomic impact so far is serious, but it's not as huge as we see in the United States or the Europe. So actually we have these macroeconomic data, we have only up to February, and we see significant declines in production and consumption, but it's relatively mild. It's -4%, -8%. And the numbers that we see in the US, for example, is just unbelievable collapse. The latest numbers on exports, however, are getting more serious. In April, we are seeing something close to -20% vis-a-vis a year ago. So that's as the world economy is sinking, we are feeling that pain. And in February, we saw some rise in unemployment rate, but we are waiting to hear the March numbers next week. And I am expecting a significant jump in job losses. And given the inadequacies of social safety net here in South Korea, I'm quite concerned about the rising human costs and social costs of the epidemic. And the financial markets were very much shaken, and the stock market tumbled, and the $1 exchange rate skyrocketed. But thanks to flattening the curve, they are somewhat recovered now. And as you know, this is happening everywhere. This close contact business activities and consumption activities are declining steeply. For example, Incheon International Airport, the passenger traffic has declined by 90%. But on the other hand, non-contact businesses, delivery services, streaming services such as the one we are using now, etc., are rising very rapidly. There are these industrial level changes. Overall, the South Korean economy has been expected by the IMF to decline by 1.2%, so minus 1.2% growth rate by the IMF. There are a wide range of forecasts because of the huge uncertainties involved. The range is very huge. One thing going for actually this minus 1.2% growth rate is the highest among the advanced countries. And that is obviously due to the relatively successful suppression of the epidemic. However, there is a negative factor for Korea, which is that we're a very trade-dependent country. And so when the global economy suffers, we suffer too. So that's my short presentation.
Thank you. Thank you, Professor, for sharing your insight and indeed for going into the specifics. And by the way, we had some issues with your presentation, but we heard you loud and clear. So I simply want to thank you on behalf of UNITAR and on behalf of all the organizing team for taking time in the middle of your meeting. A very good compliment to what Ambassador Sun say about the case of South Korea. Very good. Now we will move to the case of the People's Republic of China. And it is my great pleasure to introduce Mr. Wang Yanxiang, the director of CIFAL Shanghai and also a senior fellow at the United Nations. He will have a translation by Mr. Wu, the deputy director. So Mr. Wu and Mr. Wang, welcome.
Alex, thank you very much. And first of all, I will explain Mr. Wang asked me to make the presentation today now for him. So now for me, I will have a brief introduction about the general overview of the current situation in China about the COVID-19 in China.
Yes, yes, go ahead. We are looking at the presentation.
And the outbreak of the COVID-19 in China happened coincidentally with Chinese Lunar New Year. You know, the largest annual travel rush provided conditions for the long distance and the large scale spread of the virus, which increased the difficulty of virus prevention and control. However, the Chinese government mobilized its unified and efficient management system in a short time span while implementing isolating and prevention measures through different dimensions covering individuals, households, communities, and cities. And the medical resources were effectively allocated across the countries, while around 3 months of strong measures taken and centralized medical treatment for confirmed case, China has now managed to keep the daily new case within 2 digits. And mostly imported case around 78,000 patients are recovered and discharged from the hospital. Next PPT, please. Yeah, taking the Shanghai, for example, the city we based as an example, as an international city with a population around the 30 millions, the key to the successful containment of the disease is fast reaction. Since the early stage of the pandemic, the Shanghai expert group, with experience against the SARS in 2003, put forward the strategy to prevent second spreading of the COVID-19 as early detection, early isolation, and early cut-off the transmission routes, conducting not only at least 2 thorough tests for each suspected case, but also checking and the medical explanation to anyone in close contact, as well as 14 days quarantine. Once a case confirmed, the patients will be sent to destination hospital for the treatment. As for the up to the April 10, only 4 out of the 113 existing cases are local. The rest, 109 are all import cases. Yeah, next please.
Mr. Wu, sorry to interrupt. Could you explain those 3 colors? Go up to the previous slide, please. These 3 colors a little more, the green, the red, and the yellow.
Yes, this is measured taken in Shanghai after the situation improved and the shop is opened and the business now is opened. So if persons when visits the public area, we should show the code. Each one has a code. We call this code is health code. The green is it's okay, no problem. You can enter anywhere. If the code is red or another colors, maybe you will take care. Maybe you're not allowed to go in the public sites. That means.
All right. Thank you so much. Next slide, please.
So I think this is just now I answered about this. This is the key. Is the 3 key is the early detection, early isolation, and early cutoff of the transmission routes. And the measures I already explained that it's the 40 days guarantee and 2 times throughout the tests for the suspected cases.
Yeah. Next.
Yeah. So I think the pandemic shows that we are all in the world together, and the international cooperation is the key to the final victory. We are looking forward to seeing all the world join force across the globe and overcome the pandemic soon. Yeah, thank you.
Thanks to you, dear Mr. Wu, and also to Mr. Wang. even though we already told him hello, our appreciation for helping us all the way in China, building capacity of government officials and the like, and also today for bringing this distinguished speaker that I will announce now. So we will have next Professor Shan from the Institute of Economics of the Shanghai Academy of Social Sciences, a highly reputed and very prestigious organization that is a close strategic ally of UNITAR. So we now give the floor to Professor Shan.
Okay. Hello, everyone. Very happy to be here. And Mr. Wu just introduced the overview of the COVID-19 in China. So I could just I prepared 4 parts, like brief review, impacts, economic policies, prospects. So now I just think I could just skip the first part over. We could just get to directly to the next part. That is impact next, and the next, please. Yeah. Next one, please. I could just skip this over. Yeah.
Next.
Yeah, thank you. Okay. About the impacts on Chinese economy. Sorry, the last one. It goes too far, right? Yeah, that's right. Okay, thank you. No. Again, the last one. The previous one. Thank you. Yeah. Okay. So as we all know, the pandemic, it will not, damage the economy directly. So actually, the economy will be damaged, just because we just take some quarantine, take some measures to deal with it. And this quarantine and this social distancing, caused damage for the economy. So as we can see, when China was attacked by this virus, Chinese people were going to, have their Spring Festival, right? So, and because of this pandemic, the vacation of Spring Festival extended 3 days more. And actually, more than 20 provinces postponed their, vacation 10 more days to resume production. So actually, we could see this domestic quarantine caused a very serious attack to Chinese economy. And we could see some data released by National Bureau of Statistics of China. From January to February, industrial profit and sales dropped, as we can see, 38.3% year on year and 17.17% respectively. And we can also see what kind of industries were damaged more severely. As I just said, the damage was mainly caused by, the quarantine. So we could see 2 parts of quarantine. One is the domestic quarantine. Another one is, quarantine between countries. As we can see, the most serious damaged industries include like electronics, automobiles, electrical machinery, and the chemical industry. And all this, we could say, they are all capital intensive or like the technology intensive, and they have been, damaged very severely, as we can see here. And of course, even though now China started to, resume production, and then of course we should know it takes time to reach to the so-called full production capacity, because they need to have their employees back, and sometimes they have to face, the shrinked, market demand and something like that. Next slide, please. Yeah, next. Yeah. Okay. Things were getting better in March, and according to this national survey of purchasing managers, as we can see here, there is both, indexes of both manufacturing and the non-manufacturing business activities now we're, you know, above 50%, right? So actually that is a good sign. And almost all large and medium-sized enterprises now resume their productions. You know, this is a good sign. But unfortunately, because of, you know, something I just mentioned, like, you know, the global value chain, or the shrink the market demand, as we can see, enterprises, some of enterprises at least, are still struggling. Like, you know, like we can see the number here, like 41.7% of them face tight capital, and 50.3%, you know, for the insufficient market demand, something like that. Next, please. Yeah, next, please. Yeah, thank you. And now we like to see the economic policies taken by China. And so far, Chinese government has taken lots of policies. They are all around and progressive and targeted. And you know, I just think maybe when we get to understand policies taken by Chinese government, we just need to know we need different policies at the different phases of this pandemic. So I like to include all these policies into three categories. You know, when the pandemic was surging and the full quarantine was taken, I think the most important thing for the economy is to ease the shock, right? So as we can see here, there is Chinese government provided a free treatment of COVID-19 for all people. That is infected people, and the central bank just cut interest rate and the reserve requirement rate to release more liquidity to the market. And the government also postponed the tax and the social payment, social security payment, and provide a series of subsidies to enterprises. And when the pandemic was preliminarily under control, we could see, you know, the government was helping, you know, enterprises to resume the production, like promoting orderly work resumption and guaranteeing the supply of production protection equipment, etc. And recently, you know, as we can see now, Chinese government is starting to, you know, try to stimulate the market demand. Like in recent days, you know, dozens of city governments just, you know, try to issue the consumption coupon to households, like to reboom, you know, the market resumption. Sorry, the market consumption. Next slide, please. Okay, about the, we could just make some prospects to the near future. And according to, you know, the IMF report just mentioned by Mr. Major, it turns out inevitably we have to see, you know, the worldwide decline in this year. And it looks like, according to the IMF report, China is the one of the best too, right? According to their estimation, it turns out China is going to realize 1.2% economic growth in this year. But I like to say we have already seen some positive signs over here. That is, at least there is a consensus for more and more countries. There is more and more countries. There is we can see more and more countries now just take the quarantine in short run, which can buy some time for you know, the development of, you know, specific drugs and vaccines in long run, so that we could just put this virus totally under control. Yeah. But I think we need to, you know, at least for the Chinese government, we need to deal with the following 3 periods of contradictions well. The first one is to balance the epidemic control and the full resumption of production. And yes, China or Chinese enterprises are trying to, resume their production. But the problem is that, we can still see the new increased cases in China that is from like imported cases and asymptomatic cases. Not very big number, but there is some, right? And the second one, I think, is how to deal with the contradiction between, the improved domestic economic performance and the worsened global situation. So actually, just like I can't remember who, there is one speaker just said, we have to face huge uncertainty in the future. There is, we might see some kind of reoccurrence in some countries, and we might also see some kind of new epicenter in the worldwide. So actually, we just don't know about that. So there is how to deal with these 2 contradictions. The third one is about, even this pandemic comes to an end, we still need to face the problem, like, actually China is the first country who just put this pandemic under control as quickly as possible, while at the same moment we can also see after then there are lots of blames for each other in the disputes all over the world. I don't think that's a very, very good way to deal with this pandemic, and even for the aftermath this pandemic. So just like Ms. Major just mentioned, like the coordination and the cooperation may be the most important things we need to do, instead of just to blame each other or just to do something else. Yeah, basically that is what I want to say. Thank you very much.
Indeed, Professor Shand, an impressive presentation. Thank you so much for sharing the insight, and especially for these last 3 pairs of contradictions, because indeed, I think the world is debating between those contradictions. Public health first, economy first, or both, and then demand, and then output, and then exports, and a global recession versus a domestic increased consumption. So thank you for that, and for sharing the economic policies that China has on. Indeed, our pleasure to have you with us. Very good. Now we are going now to continue with our agenda. And I forgot to say before I announce the next speaker that we have these sporadic polls, just to ask you, to our esteemed participants, around 200 of you, or now perhaps a little less, but still a big number from around the world. Please answer the polls, and then you'll see the actual outcome. In this case, on the screen, you are seeing that the question was, are you currently working, studying from home due to this pandemic? So you are seeing that most of you are, 88%, including myself and most of the speakers. And then the last question, part of the question, which is, are you back at the office now? Only 2% of people are back at the office. Interesting numbers, and thank you again for sharing and participating in these polls. Let me advance with the agenda. We will have to accelerate a little because it's 11:18 and we have limited time, but still we must give 5 minutes to each one of the next presenters. And in this particular case, we're very happy to announce the first one from the Philippines. The next 3 speakers are from the Philippines. First, let me welcome Mr. David Castillo, Public Relations Lead at M2O Communications. Mr. Castillo, you have the floor.
Thank you, Alex. Again, my name is David Castillo. I am a PR practitioner from the Philippines. I've been working in the field for 8 years, and I've been asked to talk a little bit about the role of communication in managing this pandemic. Just before I start, everybody gave a brief overview of what's happening in their respective countries. In the Philippines, as of 4 p.m. yesterday, we have 5,453 cases, 243 new cases, and we officially have more recoveries than deaths now, which is always good news. That aside, I wanted to talk to you about misinformation and how it can affect basic health. Sorry, can you scroll back up for that slide so I can provide some context?
There, yeah.
It can harm fundamental health decisions that are being made at home. I wanted to take on the lens of a citizen who makes these fundamental health decisions based on the advisories I receive on a daily basis. Right? UN has likewise acknowledged that we are facing an infodemic. Right? Can you go to the next slide, please? There you go. This is just a audit of social media audit for Facebook and Instagram, highlighting the number of interactions with coronavirus content across Facebook and Instagram. In the period between February and March, there were over 6 million interactions, if you could imagine. 25,000 posts containing the hashtag coronavirus. And if you consider that this audit was only done with branded content, meaning it doesn't feature citizens posting, etc., etc., the number of interactions and posts could be 3-4 times over more. So this results in a lot of confusion. I'd like to pay particular emphasis here because in Philippines, social media is very big. We are considered the social media capital of the world. We spend some 10 hours every day online, which I think, given the circumstances today, with the quarantine, with many people being stuck at home, it probably extends to more than that. This whole information overload is really the crux of our problem. Next slide, please. Studies have proven that fake news travels faster than truth. Now, fake news has been an issue for quite a while now, right? But I think in our current situation, the stakes are much higher. Right? People are basing their health decisions at home based on this information that they read online, which a huge chunk of it is non-verified. And to add to that, a study from the Science Journal found that falsehood diffused faster than truth. This is very dangerous. It's very dangerous. According to that study, it traveled 6 times faster. Another finding of that study is that the emotional reactions we have to the content and misleading information that we find online is part of the bigger trigger. You know, you receive information, you want to help people learn more about something, then you forward it to your networks and it grows and it grows. The network effects are a big threat, especially when health is concerned, right? I myself, I receive this from various sources on a daily basis. I receive it from my in-law. I receive it from my friends. Some of them have, they come in various forms. They come as copy-pasted messages. They come as screenshots of conversations with blurred participants. You know, a common thread is that it's often from so distant a source that you don't know where it really came from. A friend of a friend knew something. Someone reposted it here. It came from other sources. So it's hard to pinpoint that. So it's now more than ever, I think, for decision makers and for citizens, you need to be more vigilant. You know, do the research when analyzing information. Make sure it's validated. This emphasizes the importance of accurate, fact-based information that is simplified for the audiences that we are trying to communicate to. In this case, these are the families that are stuck inside their homes. Next slide, please. As I said, when you're trying to help, this is the very thing. It's as if this pandemic is finding our most vulnerable spots and exploiting them. We want to help our relatives with information we receive, right? I recently received information that there were riots breaking out outside. People were desperate for food. This featured screenshots of articles that it seemed like it was written from a credible source. I was about to forward it. I just did luckily, I did my additional research and it was fake news. But make no mistake, I could have easily forwarded it to the people that are close to me, to my colleagues, to my loved ones, causing undue stress to a situation that is already filled with it. Again, the network effects of this are very, very threatening. Right? That instinct, your instinct to help, it takes misinformation takes advantage of that. Next slide, please.
You have 1 more minute, Mr. Castillo. Thank you. Go
Okay.
ahead.
That said, how are Filipinos getting verified public health messages? For the bigger units, for our bigger administrative units, it's quite easy. You tune in to broadcast, radio, online, social media. Our president regularly holds briefings for information on policy. But I think where it's lacking really is in the smaller administrative units, in community mobilization, which I think communication is all the more important there now. Now that for most of the countries, like the Philippines, the healthcare facilities are overly burdened, right? This shifts the first line of defense from these hospitals to our homes. And the only way we arm people against this fight is with information. You know, the national, provincial, and city level administrative units, they're more for policies, right? Outlining policies, but clarification. And when it comes to implementation, the smaller administrative unit, these are your townships. We call them barangays here in the Philippines. I think they need to play a bigger role. And the problem is there's a lack of infrastructure there. For the bigger administrative units, you have TV to access them. But for the barangays, they typically hold, before this lockdown hit, they hold barangay hall meetings, which is they gather the citizenry in a public venue, which is not applicable now with social distancing. So I think there needs to be an active exploration of tech-based solutions to make for effective communications at this level, particularly with most of our national resources in healthcare being strained by this coronavirus. Next slide, please. This is an example of one of the projects we undertook as this pandemic hit. Right? We teamed up with a volunteer organization of doctors, the Philippine Healthcare Communications Advisory Network. They're supported by our cabinet agency for health. Right? These are doctors at home that want to communicate to citizens on basic health decisions. Right? So we hosted a couple of Facebook. It's a great platform right now because it's very interactive. The problem and the limitation with getting your public health advisories from the TV, from the radio, is a one-sided conversation. And a lot of Filipinos still require clarifications when it comes to these advisories. We receive basic questions. So basic, when do I need to go to the hospital? As basic as that. What do I do if a housemate is suffering from symptoms? You know. So I think these are things for community mobilization to consider. These are implementation things. Questions like, how do I quarantine if I have a one-bedroom apartment with my family, right? These are not going to be answered by our national policies. And the most ideally positioned government units to provide support for this are our community leaders. If not community leaders, it could be even citizenry, right? In our village, private citizens set up a private chat group with all of our neighbors there, and regular updates are sent. People are linking up to suppliers to find food and basic necessities. So this level of coordination is required to drive this fight against COVID, especially as, again, the front line shifts from our overburdened hospitals to our homes.
Indeed.
And I think communication is vital to that. I can wrap up with the next slide. Sorry.
Unfortunately, time is over. You have taken 10 minutes and we have 2 more speakers from the Philippines. But it's interesting that we have in front of us the good and the bad, and I thank you for putting that up. But now I must announce Mr. Carlo Cleto, also focusing on, and again, thank you, Mr. Castillo. But now in announcing Mr. Cleto, we will continue with this analysis using the Philippines as an excellent platform to do so, on what happened with communications during the crisis. Mr. Cleto, who's a content development director himself, will be talking about using data analytics to communicate against the pandemic. Mr. Cleto, the floor is yours.
Thank you. Just like to check if everyone can hear me proper. Okay, so I will be talking about the importance of data.
Excuse me to interrupt you. Is it okay if I tell you when you have 1 more minute? You have 5, and that we are
Sure.
just starting now. So I'll interrupt you when you have 1 last minute. Go ahead, please.
All right, all right. Okay, so I'll be talking in the next 5 minutes about the importance of data and analytics for effective crisis response. Can we go to the next slide, please? I'd like to start with this quote from the Director General of the WHO, who said back in the middle of March that you cannot fight the fire blindfolded. And of course, he was referring here to the importance of data, which is a necessary part of planning and implementation in managing this crisis. And at this point, it's pretty self-evident already. And some of the content that has most been shared online were, for example, some of the models that have been done by epidemiologists forecasting how the outbreak would react given certain government interventions. And then you have countries like China, South Korea, Taiwan, who have successfully leveraged big data from telecoms providers and customs authorities to implement very effective contact tracing and case management systems. But of course, this has also been accompanied by some concern that there might be greater violations of privacy, for example, as well as increased surveillance even after the pandemic passes. And this is an important point that I'll come back to a bit later on. But the point here really is that the primary role of communications practitioners at this time really is the sharing of information. And at this time, everyone is hungry for information because this information affects the way they organize their lives in this new normal, as well as the way that they make sense of everything. Right now, there's a lot of, it can feel very chaotic at this point, especially in a country like the Philippines. If we can go to the next slide, please. Where we've run into a lot of challenges when it comes to the sharing of data that's needed to make the right decisions about managing the crisis. So here I've listed some of these challenges, but the crux of it really is that in many ways, policymakers, the government, and other organizations who are helping manage this crisis have failed to provide the information and the data that people need to make the right decisions. We've not been able to offer consistent, reliable information related to quarantine rules, for example, when people can leave their homes and when, how checkpoints work, what are the protocols to follow for screening and testing. There's been a lot of confusion about all of these points. And even as the weeks progressed, people have soundly criticized the government for failing to, for example, report accurately on the number of suspected cases as well as confirmed cases. And in fact, just today, 15 senators called for the resignation of our health minister for that very reason. They said that the Department of Health has talked about having a pretty low number of cases, but the general consensus here is that it's probably severely underreported and there are probably many times more the actual cases than what we know. And apart of course from all of these concerns, we could go to the next slide, please. There is also a need to make sure that the way data is sourced, the way it is processed, and the way it is shared is democratic. So there is a need right now, more than ever, for a democratic data regime. And this means that we have to figure out who really is responsible for collecting data, who is responsible for analyzing it, and who is responsible for sharing it with the right people. If we can go to the next slide after this. In the past couple of weeks, we've been working very closely with the government, its interagency task force, the architects of the National Action Plan for managing COVID-19. And we've just reached a data sharing agreement. So as of 2 nights ago, the Department of Health finally shared some critical information related to the number of cases here, the capacity of hospitals, as well as their supply of consumables and durable medical equipment. But before the data sharing arrangement was made, next slide, please. A lot of the a lot of the private volunteers actually had to collect the data themselves manually in very creative ways. So we've been working with volunteer groups who have been calling hospitals every day to ask how the hospitals are doing, what kind of supplies they need. And the short point of it is it's been quite difficult in the past 2 or 3 weeks to get the data that you need. But as of 2 nights ago, the DOH finally shared the data. Next slide, please. And a lot of this, which I personally believe is important if we are to make the right policy decisions, as well as if we are to encourage proper citizen participation in managing the crisis, people really need access to this data. And finally, it's available to us. And so we've accelerated some projects alongside our partners in government and the private sector. Next slide, please. Can we go to the next slide, please? So one example of what we're doing is we create this daily newsletter that we send out to thousands of recipients each day, members of the Interagency Task Force in government, as well as members of civil society organizations. So this is something that's being done as a sort of voluntary effort on our part. Next slide, please. So here in the next few slides, I'll be showing you some tools that we've developed alongside our partners. Next slide. One of the tools that we came up with is a sort of GIS-based system that should help with hospital triage of patients. So as you all know, healthcare systems around the world are very stressed and overburdened right now. So through tools like this, we're hoping that the people who make these decisions will be able to make the right ones and send the people where they need to go. Next slide, please. These next few slides here, this is also another GIS-based system. And what we do here is we track the supply of consumables such as PPEs, as well as durable equipment such as ventilators that are needed by hospitals to fight COVID-19. So as we all know, there's been a great shortage of these supplies. Next slide, please. And what we want to do with this website is we want to encourage people to actually make donations to the hospitals directly. So the way it works is we calculate the supply needs of each hospital based on guidelines issued by the WHO, the CDC, and the ECDC. And then we use that to come up with a target supply of PPEs, for example, like N95 masks or medical gowns and other things that hospitals need. And then there's a way for private individuals or organizations to make donations to these hospitals directly, either in cash or in kind. And we are just about to launch that hopefully by tomorrow. Next slide, please. And so it's a GIS-based system. So there's a map here, and you can see which hospitals are closest to you and which ones are the most in need. Next slide. And we've also been working on using data science techniques such as social network analysis to understand the narratives or storylines that are being shared about COVID-19 here and around the world. And we believe that this is very important because in our previous work with the UN, we've come to understand that a unified narrative is a central piece of any communications effort, especially in an effort like this where a lot of different organizations have to collaborate. And in the absence of that central narrative, it's very difficult to align our goals. And to get to that narrative, we believe that one important part of that is understanding the stories that people tell about this pandemic and also identify the people who are sharing these stories. So one technique that we're using right now is called social network analysis. And this chart that you're looking at right here is just this is a chart of Twitter users who have been engaging with one another in relation to COVID-19. So we've also been doing stuff like that.
You have 1 more minute.
Sure. Okay, let's go to the next slide, please. I think I'll be finishing right on time. Okay, so I guess at this point, I would just like to end by saying that even if we've been talking a lot about a lot of hard data, a lot of information that are being used by administrators and policymakers, one important ingredient I believe that we should never take for granted are emotional intelligence and empathy. And some countries have been doing this a lot better than others. In my country, there's been a lot of criticism, and I feel that it's warranted because a lot of time, the way that we communicate with our constituents and the people who actually are suffering the worst of this crisis lacks these two important elements. And there are some good examples out there, like, for example, in New Zealand, where we see that their leaders communicate these very difficult pieces of information in a very empathetic way that stresses and emphasizes that we are really all in this together. And it's only by working together and understanding each other's needs and problems that we can get out of this stronger than before. And I guess I just feel like to end at that point, we shouldn't just be talking about hard data all the time, or maybe administrative stuff and things like that. We should also always think about the way we package that data and share it with people. And that's what I'm talking about when I talk about emotional intelligence and empathy.
Indeed. Yes, thank you, Mr. Cleto. An excellent presentation indeed, especially on how civil society can leverage data management and data mining and data reporting, so the rest of the population can actually see this particular example of how the hospital capacity is easily accessible is quite unique, and the first time that we see it, at least from a country similar to yours. Thank you for that. Let me go to the last speaker from the Philippines, and let me introduce Ms. Angeli Jane Blanco, Head of Communication and Office of the Research Institute of Tropical Medicine. Ms. Blanco, you have 5 minutes, and I welcome you.
Hi, thanks, Alex. Hi, I'm Jali of the RITM in the Philippines. I head the communications office. So I'm here to present to you the strategies we've been doing in terms of communicating the crisis. Well, so as you know, COVID-19 is not the first outbreak that RITM has responded to. Being the national reference laboratory for emerging and re-emerging infectious diseases, we have always had this mindset that we are the nation's first line of defense in public health emergencies. Now, we have always had a preparedness plan, but since COVID-19 is caused by a novel virus, we had to move twice the speed to explore all options and deliver the best possible care and service that we can provide. So right now it's business as usual for RITM, only that the pressure is immense to perform faster and better and more efficiently.
It seems that we lost you. Ms. Blanco, can you hear me?
Yes, I can hear you clearly.
Go ahead.
Yeah. So the practice is the same for communications management, whether or not there's a pandemic. It had been made extra difficult by an excess of information coming in through different channels, but the primary consideration is the same with or without a pandemic, and regardless if the audience is internal or external to RITM. So you have primary considerations: what information needs to flow in and out, who needs this information, when is the information needed, and how will the information be presented, where will that information be transmitted from, or which platform are we going to use, who is responsible for providing inputs to the information we intend to transmit. So with the internet and the chunk of the population staying at home, there is a pressing need to be present in wide-reaching platforms. It has become increasingly essential because news spreads faster now, and unfortunately, as discussed previously, false information travels at the same accelerated pace. So this is to be expected, and it is not entirely a bad thing, but because at the very least, false information alerts communications managers of what materials do the public urgently need, especially in this pandemic when a lot of things remain unknown and unclear. It is understandable for people to scrape for answers and share info on what they think addresses their questions. So communications managers must then be able to provide the facts in the easiest and most understandable way possible. RITM has been doing the following communications efforts independent of the Department of Health. We are under Department of Health, but we exercise our communications efforts independently. So First, we translate science. We gather online research articles and scientific journals on COVID-19, and we translate them into layman language because there's a lot of information on available on various channels that are credible. Let's say it's the website of the WHO, the CDC, the DOH, and RITM. However, the public primarily overlooks these information because the way they are written and designed are highly technical in nature. So information that is difficult to understand is highly subject to misinterpretation. And the main challenge we face in terms of health, medical, and science communication is that unverified information travels much faster with the internet. So everyone is on high alert and there's this mounting panic. And unfortunately, it can be commandeered by mass articles, W's claims about the disease, which generally undermines the hard work of RITM, DOH, and the entire health industry. So next, we engage with the citizens. Next slide, please. So citizen engagement is enjoining the public to assist RITM in routine communications work, such as media monitoring, transcribing, and translating public statements, things, and designing information on social media. So, this date, we have 5,000 individuals who volunteered and expressed their intention to assist the communications office of RITM. We have also been approached by celebrities from the entertainment industry, graphic design groups, advertising agencies, and public relations firms. So engaging with the citizens is strategic in terms of minimizing public noise that is unfortunately misinformed. In essence, for every volunteer we activate, the more hands and clout we have to get the truth out. We will make ripples in change. We put ripples in silencing false claims with said volunteers, their families, friends, colleagues, and immediate contact. So, mobilizing the public also encourages engagement and national participation rather than passive involvement. So all in all, the goal is to expand how the health sector must deal with crisis communication going forward. So next to that, communication is a supplement. Next slide, please. Communication functions as a supplement to frontline services. So effective communications supplements tireless efforts of the medical practitioners, lab personnel, and healthcare workers on the ground. Because as you promote infection prevention control measures that every citizen may perform on their end, you are trying to help, you're trying to assist in minimizing the contraction of the disease. That's why supplementing effective communications is necessary so that you can supplement medical care and laboratory functions.
Thank you.
And then next.
Yeah.
Yeah. Please. Sorry, next slide. There. I was supposed to discuss media relations, but since we're on this slide already, it's important to, internally, it is important to convey the purpose of our work and how each staff member contributes to the bigger picture. This is crucial because ensuring that there are channels where internal members of your organization, where they can express their opinion, thoughts, and suggestions is a manifestation of the organization's desire to get opinions, suggestions, and to brainstorm with its employees. So it is also an acknowledgement of their expertise and experiences. So informing the internal community on the efforts of the organization and the developments that may affect them supplies the necessary transparency to gain trust. Because we have to remember that the internal community has their fair share of anxiety about the crisis. Hence, exceptional effort must be made to make crisis response and efforts an inclusive endeavor. The strength of RITM lies in each and every one of its members working together in perfect cohesion. So therefore, complete faith in the organization's mission must be nurtured at all costs. So in communications, misinformation is our biggest opponent. It adds to the confusion and panic and hinders factual information from getting through public consciousness. So misinformation on the nature of the disease is the primary reason why healthcare workers are being subjected to discrimination and even violence. So I know we are all looking for a cure, a vaccine, or any possible technological innovation we can use to protect ourselves and our families. And it won't take a miracle, I promise you. Efforts are underway globally. Our healthcare workers and experts around the globe just need more time and space to sift through all the noise and make sense of all the information, discoveries, and literature behind the disease. So just a reminder that science takes more than a day. And so while health industries worldwide are exploring all prospective disease correction and prevention measures, communications management must then be proactive to ensure that they are given their adequate space to think and the public fears and anxieties to be assuaged. Thank you very much.
Absolutely. Thank you, Ms. Blanco. Very interesting to see the perspective of your Institute of Tropical Research for Tropical Medicine, and also how you do this part that somehow is forgotten and put in aside, which is citizen engagement, how you manage communication as an official agency, and the like. I appreciate that you have given us this insight, and now we will move to the last country that we will cover today, but definitely not the least. I'm referring to the Philippines. It's my pleasure to give now the floor to Dr. Termitopi Ekbelakin, the Director of CIFAL Newcastle and a professor at the University of Newcastle in Australia, a great strategic partner of UNITAR. Dr. Temi, the floor is yours.
Thank you so much, Alex. I've got a slide here that I want to share. Is that possible, Mata? Can I share my slide?
I don't think so. You need to send it to Marta, and then she can put it on, but perhaps you can refer to it because in these webinars, only one person can share the screen, which is the person managing the presentation, and I apologize, but you can go ahead and explain it. Yeah.
Okay. I only have 5 minutes. I've got very few slides. I can send it for distribution before. We had a first, I'm going to be sharing the perspective of Australia about COVID, where we are, and then what's been going on, what we've been doing. So we've had a first outbreak in February 2020, like most every countries, and then we did some modeling that actually shows that if we don't control this pandemic very well, we are going to be running out of ICU bed. We're going to be running out of a lot of resources. It's going to be a uncontrolled outbreak. And then so we looked at different scenarios where we look at either uncontrolled situation, whether we use quarantine and isolation, or we use quarantine, isolation, and social distancing. So with those modeling, we found that using the 3 methods together, which is the early February, worked very well. And which the government, our prime ministers and the rest of the government have been very helpful. So we've applied these 3 methods, which is quarantine, isolation, and social distancing from the onset. But now we are also doing aggressive testing. So with that, I'll just give a summary of what we have in Australia at the moment with some of the measures we have put in place. Currently we have 647 cases in total. Yes, we're a very small country with over 20 million people, but I would like to give kudos to the Australian government, Australian people. They've been very, very supportive. People have actually listened. They stayed at home. I'm currently working from home as well as a lot of other colleagues. And then, so we only have 63 deaths reported as of this morning, which is 16th of April. And so far so good. We've had 3,686 cases that have recovered. At the moment, we have only 76 cases that are in intensive care, with 214 mild cases that have been admitted to the hospital. Currently, with the addition of the aggressive testing, we've tested 371,000 people, with only 1.7% have tested positive. Here, we are not saying that this is the correct figure, but we are certain that we are close to the actual figure. And across the states where we are, New South Wales has the most significant number of positive tests. We have about 147,000, although we are the most populous city in city in Australia were about 7 million people. So with all the measures that we have put in place, we also found that we have more women that are actually being affected by COVID-19, basically being healthcare givers and also carers at home. And then however, we've had more male deaths, especially those between the ages of 50 and 90, but we have more deaths between 70 and 80 that are male. And then at the moment, where we actually found that most of our sources of infection were people that are actually coming from overseas. So with the measures that the government has put in place, we've been able to reduce the local community transmission. And at the moment, the government has also put in compulsory quarantine that is fully paid by the government for people coming from overseas. So if you're landing in Australian borders, you're going to be quarantined for at least 2 weeks and tested and isolated. And also we've got a very good public health response that within all the states, all our nurses and teachers and everyone has been very supportive. And then we have seen a downward trend. I don't know whether you have this slide. We have seen a downward trend in—
Go to the previous, sorry, Dr. Temi, go to the previous slide, Marta, because we had put some from our own input, some slides that show.
This may be old ones. Now we've seen our curve actually significantly coming down as of yesterday with the mapping that the government released yesterday. So at the moment, we have only 6% of infection rate, which has actually gradually reduced from 30% to now 6%. As of last week, it was 9%, but now as of today, 16th of April, we have 6% rate of infection, and our curve is actually now, when you have the downward curve, we're not having actually a straight line where we're actually maintaining a very low number of infection. So where we are now is that we have very new cases every day, very reduced significantly, and our curve is flattening. And hopefully, we hope that we'll be able to stay. We'll be able to stay there. Although we understand these cases that are arising in China, in Singapore at the moment, that if continued measures is not put in place, we'll see the curve actually going up again, picking up again. So what the new policy that the government has actually put in place this week on Tuesday is that we'll continue in isolation. People will continue to work from home, and our government has been very, very generous to actually put in place a lot of economic policies to support businesses that are going down and also to support industries to actually be able to implement some of these measures that are put in place. So that is just a summary because I know we are running out of time. I would just like to hand over to my colleague, Professor Vijay, who is the chair or an expert in cybersecurity and managing cybersecurity issues in this pandemic. Please, let's join me to welcome Professor Vijay to actually talk about the impact of cybersecurity in this pandemic, which is also a very big and significant issue that we are dealing with globally. Thank you very much.
Thank you, Professor Temi. And yes, we welcome Professor Vijay Baradharan, Global Innovation Chair in Cybersecurity at the University of Newcastle in Australia. Professor, the floor is yours.
Thank you, Dr. Temi. Thank you, Alex. I remember meeting you 2 years back at Newcastle here. It was nice to see you again. Look, first of all, thanks to Professor Temi for giving this brief summary of Australian context. As she said, as of today, there are about 6,464 cases and 63 deaths. Now, my topic is in cybersecurity, but I just wanted to say a little bit about the context and how there are these parallels between what happens in the biological world as well as in the cybersecurity world. Having been in security for over 30 years, and in the early part of 90s, we learned a lot from the biological immunology and virology, and when we did security work as to how, the virus, the virus term is actually used in antivirus products. Many of the terminologies in computing in this space come from biology. But now I find that there are certain things that we have done, many countries have done, the measures that they have put in place are similar to what we do in the security world. So basically there are two types of strategies we have. One is mitigation and it's containment. And containment is the first thing we follow, and every country has followed that by introducing border control, whether it is from specific, initially from where there was the epicenter in China, so there were controls put for Chinese, coming from China, and then it moved to Iran in the case of Australia, then we moved to South Korea, and then we had successively be introduced control, the border control, which is exactly what we do in the technology world, which is the sort of firewall gateways and stuff. Secondly, we do mitigation, and the mitigation, in order to do this, what we do in the biological world, of course, we need to test. That is, find the infectious cases, which we do for malware detection. We do exactly the same thing in the technology world. And once we detect the malware, which we detect the virus, we quarantine, we isolate, and we do the trace back in the technology world, which is exactly same as the contact tracing. And in the technology world, trace back is, we are able to do that because there are unique identifiers going back in the internet. So that is possible. And then isolate, and then we also isolate everybody in every system from every other system, which is what is that we do in social distancing. So essentially, there is this amazing parallel between the technology world and this. So there are some things to be learned. I will leave that today later on in a further discussion from the technology world, which is sort of relevant for the biological world. Now, the topic today is cyber attacks. As we see, what happens is in the world, there is an opportunity for when these things happen, when there is a calamity or a crisis amongst the population, amongst the societies, there is always opportunities. There's always, security people, we always think of the ability, wanting to cheat, wanting to take profit, take the opportunity to attack, for personal benefit, for societal benefit, or community benefit. So essentially, my next 4 minutes, Alex, is going to be on the threats which we see in the world, and then some mitigation strategies we might have in this. So the three major threats which happen at the present time are malicious website. So that means what happens is you think you're going to a website which is genuine, but in fact it has got some malware in it, or some malicious content or malicious software in it, which gets uploaded to your machine, and then it does some bad things to you. That is one. The second thing is phishing emails. You think messages coming from your people that you know, or from an organization you know, and it looks pretty genuine, but they are phishing the word PH rather than F, and then basically it dupes you, it deceives you, and so you give away your information, personal information on it. The third thing which happens in these types of calamity is because especially now with this, what we have done is we are working from home. There's a fantastic opportunity to attack, this new mode of operation, or mode of operation which has become more prominent. It's always been there for about 20 years, but it has become prominent now. So these have been main things. In Australia, we have a government-wise, we have the Australian Cybersecurity Centre, which is the government organization which tracks all these events that have been incidents that have been happening. And in fact, there has been something of the order of over a 2-week period in the mid of March 16th to March 30th, there has been about 100 cybersecurity incidents relating to these three types of activities that I talked about. So the next slide, please. Next slide, please. Yeah, so I've already mentioned that the malicious website is you go to a website and then it installs in your machine bad things which are called Trojan. And the one which was detected often in this first period in the February, March is a one called Cerberus, which is basically it takes away your financial data and is primarily targeted mobile devices such as the Android. So that is a very common one. And the second one, next slide, please. The phishing email. Next slide, please. The next one, the phishing email, that is where the messages tend to come from. You believe the messages are coming from reputed sites. And here, the common attack was one of the major attacks was the messages were pretending to be coming from World Health Organization. And that was, but they were cyber attackers being set up all over the world. By the way, they will set up the things, these websites anywhere in the world, and they can send you messages and pretending to be somebody else. And then when you try to open that email, then what happens, or some attachment which is already there. Sometimes you have to open the attachment. Sometimes these attachments automatically download just by opening up your email, and then gets installed in your machine, and therefore your machine gets infected. So it is almost like the same thing as we have virus infection passing through the droplet or through the contact. This is happening in terms of your technology. Next slide, please. Next slide, please.
Yes, it's just a small delay in time, but right there. Go ahead, Professor.
Okay. Okay. This is more what.
No, previous Marta, something happened.
Yeah. So what I was going to talk about, yeah, this is the one which is taken a little bit of by storm in the last couple of weeks, and that is the usage of video conferencing tools and the problems associated with it. Particularly, this has happened in the case of Zoom. What has happened is with Zoom, for like the one we are having now, what happened is there are security flaws or bugs in software which enable other people who are not uninvited as guests to join the conversation, and in fact be able to inject within the conversation any material. This happened in Singapore, for instance. I think it was geography school class which was happening in Singapore, and some rogue actors came into the secondary school geography class and injected some obscene messages and pictures into this thing. And this is quite a common thing which is beginning to happen now increasingly. And the reason why it is happening is very simple, because more and more people are using these technologies, and cyber attackers always find it opportunistic to take this, when there is more usage, there is an ability to attack, an opportunity to attack and make, gain profit out of that. Next slide, please. So having said those three basic types of threats, what are the types of mitigation strategies all over the world? We are, different companies. I mean, the companies have got a very significant role to play, because most of these, from a technology point of view, most of the products like Zoom and WebEx, they come from certain companies, so they have a inform themselves and to use properly the settings. That's the second role. And the third role is that of government to be able to put some regulations, so when things go wrong, to be able to take down the malicious website, to take some action. So there are all the three parties need to be involved. There is an obligation from the manufacturer point of view, obligation from the user's point of view to educate themselves and to use it properly, and the obligation from the government point of view. So very basic things. I think make sure you look at who's sending that email, make sure it makes sense before clicking it. Do not ever open unsolicited emails. That's very common, and never ever reveal personal information via email to unknown sources. And also, this is very useful to have multi-factor authentication. Make sure you have two ways of just not the password, but some other channel, such as a one-time password coming in the mobile phone. Next slide, please. Yeah. So there are also some lessons for the organizations. So for instance, a lot of now the employees are working from home. There is an obligation from the organization point of view to ensure that they have a secure connection, the VPN, which is for virtual private network. And it is important to ensure these updates are being done to the virtual private network software. This was another attack which happened 2 weeks ago, whereby the attackers there was some update. There was some VPN software which were not updated. That means they had some bugs in it, and those were used by attackers to get into the channel, the VPN. So that was a problem. And nowadays we also tend to use more of Wi-Fi. Make sure you never, be careful when you use the public Wi-Fi. And given that there are, many charity organizations, many organizations asking for donation, now be careful when you go and donate this thing. Make sure you are actually donating to the person that you intended to donate. So these are some of the mechanisms. Next slide, please. Next, yeah. So this one is my last slide, but then I want to finish off. But this is sort of I just collected a set of things that might be of use to people who are using conferencing tools such as Zoom. Make sure, sometimes the Zooms, even this one does not have a password. Make sure we have a password associated with the Zoom. Make sure that the host, checks the participant before including the participant. There's the waiting room feature. Do not necessarily share your meeting ID with other people, and make sure you lock the room, that is the lock the Zoom community once all the people are in. So these are a bunch of simple setups that we could do with Zoom thing to make things happen. But let me now, I just want to wrap up by saying a few things about cybersecurity in general in this terms of crisis. So
you have one more minute, but yes, go ahead, Professor. Yeah.
How many minutes have I got?
One more.
Brilliant. Okay. So I think the major thing, what happens in this type of crisis is, technology. If you look back, what's been happening, we have, globalization has been happening, and technology has been helping the globalization process for sharing, and both for data sharing, service sharing, and goods and so on. But what this crisis has sort of indicated now is, one, there is an increased tendency for protectionist policies, and we should completely make sure we should avoid that. But as trading countries like Australia, and previously I heard South Korea, there was some similar thing was mentioned, it is critically important to ensure that we are able to trade without putting tariff barriers and protectionism. This is something which is one of the potential worries. I think this is probably the biggest worry of a country like Australia, is to ensure that the protectionist policies do not happen. The second thing which has this impact is there is an increasing need for now self-sufficiency. People begin to realize, I'm not getting the medical equipment, I'm not. So that is another implication in the global impact of the economy. And especially there are certain technologies where we believe the self-sufficiency will crop up increasingly. Cybersecurity is one of them. Food security is one of them, and medical security, and supply chain generally. So I think I want to finish off this thing. I think as a security person, yes, we need to protect ourselves from threats, but at the same time, we need to ensure there is global interaction. We need to ensure that we are talking to each other, we are trading with each other, because we need to grow the pie rather than trying to have protectionist policies. I think that is probably the most important thing. There is a lot of issues with respect to surveillance and other debates on privacy, which is just going to be an offshoot of what will happen afterwards. As of now, the technologies are being used for good purposes, for benign purposes, but we have to be careful that we still maintain vigilance and ensure that not only we have security, but also we have privacy. With that, let me finish.
Thank you very much. Excellent presentation, Professor, indeed. And I do thank you for not only explaining the perspective of cybersecurity as a whole, in addition to the case of South Africa, this is a global pandemic in itself, but also for giving some very practical measures or tools or actions that we can take to protect ourselves. Brilliant. Thank you very, very much. And that was Professor Vijay Varadarajan, a good friend of ours that I had the pleasure of meeting last time I was in Australia at the University of Newcastle. Now, we have run over time, 12 minutes now. We were supposed to do this in 2 hours and so on. But instead of a Q&A, I will just read 2 things that were posted in the Q&A. And the first one pertains directly to Professor Vijay, and I will read it verbatim from Ms. Monica Adalim, because it's very relevant what happened. And if you were monitoring the Q&A or the chat, you will have seen that, unfortunately. It says, from Monica Adalim, earlier during this webinar, there were several chat messages that appeared. That doesn't make any sense, of course. Those messages that I saw say, hypoglycemia, confusing, right? Cut yourself some slack. That was the message, and it was posted like very many times, maybe 20, 30 times, just to disrupt the Q&A. And in the chat, perhaps, yes, also some racial slacks with one word, very disrespectful. But anyway, it's an open meeting. That's the nature of it. It's open to everyone. But we will, moving on, we will actually follow some of the recommendations that you told us, Professor. We have used some basic ones. You need to register, and we need to know your email, and we can block as we have some things and so on. But if I continue to read, it says, the reason, Ms. Monica Dalim, the reason I think why the chat feature has now been disabled is this, correct? This is what we did. We reacted fast. Thank you, Sebastian and Marta. And then she says, I was reminded of several articles, warnings on the use of Zoom for webinars, online meetings during this COVID situation. Was this the case earlier? Unfortunately, yes. And then she asked a very interesting question. She says, did a hacker enter the chat? I am now fearful if my computer and data security has been compromised. Not necessarily, it hasn't been compromised. I can tell you that because I have asked these questions. I'm not a technical person, but we do have technical people there. But I wanted to ask Professor BJ to give a short reaction to that, and then I'll give you my last comments. Professor BJ.
Yes, thank you, Alex. Yes, look, I saw that set of message in the chat. I realized what was happening. So what happens is, even, you said at the beginning, Alex, there are about 200 registered people, and we are about 10 of us in the panel. I think once the 200 and whoever registered, we would, two things we could do. One is say only the registered people are able to send messages, to send the chat thing. And the second thing is, once the total number of registered is finished or closed, and that's it. The Zoom session is being closed for new entries. So those are the two opportunities we have. Now, coming to, sorry, the question I forgot. What was the question from Monica? Is there being infected? No, you will not be infected by this thing. That is just that the channel has been hijacked so that they can do the input of the data into that, but there is no infection into your machine at all. Sorry. Was there a question Monica had, Alex?
No, that's excellent. That's exactly what we needed. And I thank God that we have you here and that you have been very proactive also in helping us to understand the dynamic of this pandemic. It's not only health, it's not only social disruption, it's not only economic, it's information war.
Yeah.
But anyway, I have some last comment because, as I say, unfortunately, we have run out of time, but you all did an excellent job, starting with Ambassador Sol all the way until Professor BJ. And before I conclude, I wanted to go back to China. And I am very honored that Mr. Wang, who's a very important man in Shanghai, is back with us with Mr. Wu. In China, we are seeing the effort of the government to go back to normal. We heard from Professor Shan the percentages of how the economy has been affected in January, February, and so also some comments on March. In April, this dichotomy, he mentioned three, but the first one is the most obvious, and it happens in every country, wherever you are seated now. It's very difficult for a government official to decide when and how much can the economy go back to normal, when to release the stay-at-home measures, when to change public policy, because indeed, this global health pandemic is affecting the economy already. We also saw the forecast from the International Monetary Fund. You just Google it and you'll see from several sources that we are already leading to a recession. But because we have to remain realism, but also optimism, it's quite interesting to see in the case of China and some of the countries as well, not only China, why this going back to normal in a very, very maneuver, address, contain, pre-designed, conservative manner is important. And we have seen in this series of webinars with some government officials participating, or from anyone from the civil society asking, how there is this extreme pressure for people, especially in developing nations, to go back to normal, because in developing nations, perhaps the governments have less capacity to provide subsidies, to defer taxes, to actually give loans to companies to maintain employment. And there is a big percentage of the population. The case of the Philippines is similar to my case in Latin America, to our case in Latin America. Perhaps half the people, literally, and I say with utmost respect, live day by day or week by week. If they don't go out to offer their services, to sell their products and so on in this kind of informal economy, they literally will run out of money to eat. So I want to invite all the participants still listening to go deeper in that analysis and to do something. We have always made this call. Our Secretary General started and we simply replicated. We have to care and we have to go beyond just the sanctity of our homes that protect us and that we are working from home and so on. But in the reopening of the economies as is happening in China or in Spain and in some other countries, even if we stay at home and we don't go back to normal, to our offices or productive activities, we can do something. And that's what we are asking for, to remember the vulnerable, the discriminated, the marginalized, the poor, the widow, the orphan, the migrant, the refugee, and the like. You can make a difference, and I simply wanted to finish today by remembering, depending on what you believe or what your faith is, we say love your neighbor in the Western world. Regardless of that, you can care and you can make a difference. Think about it. I invite you to do that and to care for the rest. And with that, I simply want to thank again all of the speakers and all of the participants that have stayed with us, and I declare this webinar concluded. Thank you very much. Have a good day. Blessings.